Good afternoon, everybody. Good afternoon. Welcome to Centre for London's third public webinar on responses to the coronavirus crisis in the capital. We're very pleased to have you all with us. I'm Richard Brown. I'm Deputy Director of Centre for London. We're the capital's dedicated think tank. We develop new solutions to London's critical challenges and advocate for London to be a fair and prosperous global city. And we do that through publishing research, through holding events, through convening, through influencing. We're holding these events because we know that the pandemic is having and will have a profound effect on pretty well every aspect of life in London. It's laying bare a lot of hidden problems and inequalities. It's highlighting some of the fragility and interdependence of the city and the infrastructure that supports us. And we're working on a programme that looks at how London's going to come out of the crisis, but also trying to bring people closer to some of the problems being met over the past month to 6 weeks, as we've been in the thick of it, if you like. And today we're focusing on the challenges facing homeless people and the support services that they receive during and after the crisis. And I'm really pleased to be joined by our guests this afternoon. They are Petra Salva, who is Director of Rough Sleeping, Migrants and Westminster Services at St Mungo's. Petra has been working for 25 years with rough sleepers, mainly in London, with spells at Thames Reach, Broadway, and directing the Mayor's No Second Night programme, and has received an OBE for her services in this area. Guy Arnold is Commissioner for Rough Sleeping at Camden Council. He's worked at a range of different organisations relating to homelessness and rough sleeping in London, including Centrepoint over the past 20 years or so. And David Eastwood is Rough Sleeping Manager at the Greater London Authority. He was previously at Westminster City Council, where he worked on rough sleeping. I mean, people here will probably know that Westminster is pretty much the epicentre of rough sleeping in London. He worked there on rough sleeping, community protection, and substance misuse issues. So great panel to have this afternoon, and great opportunity to actually understand what's been happening behind the headlines as London has adapted to lockdown. In terms of format, we're going to ask each of our speakers to share some insights for about 5 minutes. And then we'll take questions and observations from members of the audience. And we'll focus first perhaps on some of the short-term impacts of the crisis, but I hope we'll also talk about what lessons we might learn in the longer term. There are various different ways to give questions to the panel and make observations. Those of you who are following the event within Zoom, you can raise questions using the Zoom Q&A function, which you should see as one of the buttons on the bottom of your screen. You can also just respond to other questions or throw in other observations through the chat function, and we'll be keeping an eye on all of those through the session. Those of you who are following on YouTube, you can feed in questions via Twitter using the hashtag #LDNResponds. And we'll try to get through as many questions as we can. We'll try and group them. We'll try and answer as many as we can before 5 p.m, where we'll finish pretty promptly. In terms of background, London has, over the years, clearly had a big problem of homelessness. It has 10 times the rate of homelessness overall compared to the rest of England, and a particularly acute problem of rough sleeping, and people, I think, have observed that rising in recent years on the streets of London. As coronavirus reached the capital at the end of March, there was an urgent appeal to house the homeless, with councils, charities and health services working together to bring everyone in with significant success, I think. We'll talk more about that in a moment. But there has now been signs of a new wave of rough sleepers, including people who've lost jobs when lockdown started, who can't afford rent, who've had trouble affording rent, who may be escaping abusive situations at home, who also now need support. And many of the normal ways of support, a lot of the infrastructure of food banks, passers-by, cafes, isn't there to support people in the same way as it was previously. So some huge challenges of transmission and infection and resilience within the community as well. But despite these challenges, we've seen some leaders noting that the crisis is giving an opportunity to do things in different ways, to create new types of partnership, and to give people support in relation to housing, substance abuse, mental health and employment issues, alongside supporting their immediate needs for shelter. So I hope we'll be able to draw some positives out of lessons for the future. But I'm now going to turn to Petra and ask her to say a little bit about the immediate challenges of the crisis, what we know about how the crisis how the medical crisis hit homeless people, and what St Mungo's has been doing both to help its existing clients, but also to reach out to people at the sharp end. Petra.
Great. Thanks, Richard. Thank you so much. It's great to be here. I'm going to try and stick to my 5 minutes. First of all, I want to say that I think the starting point is we all know that rough sleeping is harmful and dangerous, and it's so true now in this pandemic and this crisis. So I want to say one thing about our staff and the people I've worked with. I want to start on a really positive note, because through times of challenge like this, I think I'm really hopeful. I'm really hopeful because I've seen the charity sector come together. I've seen politicians come together, local government, central government come together to talk and to try and find a solution to what is, quite frankly, one of the most horrible, acute forms of homelessness and poverty in the capital. And I want to say how humbled and how incredibly proud I've been of our staff and my staff and all staff that have actually contributed and worked around the clock to make such a difference. And we cannot underestimate the energy and the effort of those on the front line. So a huge thank you there. In terms of what's been achieved, I've been doing this for over 25 years, and I've never seen us galvanise and do things as quickly and as rapidly as we have done. Hundreds of people helped off the streets in almost, to begin with, in the first 2 weeks of this pandemic when the lockdown began, astronomical gains in terms of, safeguarding people, making sure people are safe. So certainly St Mungo's, the charity I currently work for, has helped hundreds and hundreds. We're currently supporting well over 1,000 people in London alone to care and protect for them, to make sure that they don't become ill. And we've supported and worked with the GLA to help facilitate that across the whole of London, particularly with the Pan London Hotel Initiative. And hoteliers like Holiday Inn and Ibis and Travelodge stepping up and providing safe rooms so people can isolate in self-contained units. And wow, what an amazing thing we've seen in how people themselves as individuals have changed. We've seen people come off the streets who haven't been off the streets for years, 10, 20, 25 years in some cases. We've had outreach staff in tears, knowing that there's huge opportunity. We've had our clients who've been street homeless for many years realizing that this is, fearful of their own health, also being, helped off the streets. So it's provided an amazing opportunity for us all to come together. So we're currently in what I'm calling a care and protect phase. Essentially, that is, after all this energy and effort of getting as many people as we can off the streets, we're now trying to safeguard people. And remarkably, and I think it is remarkable actually, how few people within this cohort have actually become sick. I think it's remarkable how we have a COVID care site set up for people who are symptomatic, but we've only got a handful of people in there. Now, is it that we've dodged a bullet? And we've done it, because we've been incredibly fast, we've been quick, we've worked with health, we've worked with, different charities and organisations to act so quickly, or is it to come? I like to think it's the first thing that we've done incredibly well, because this group are amongst the most vulnerable and, exhibit some of the most chronic health conditions. So you would have thought that this group would be the most at risk. And so far, what we found is that we've really been able to keep people well and safe. I think the downside is that with this incredibly fast approach to taking people into hotels, of course, those left behind have been some of the most critically vulnerable, substance misuse issues, perhaps mental health issues. And despite the very, very, huge gains we've made, there are people who remain on the street. There are people who we've not been able to find a solution for. And then there's a growing problem of new people coming onto the street, and evidence that shows that people are becoming homeless and rough sleeping, in fact, because of COVID-19. And obviously we are now at capacity. It appears that in London, we're now at capacity. So our attention is on what do we do next? How are we going to make sure that those people do not return back to sleeping rough? Those people do not have to return back to that way of life. So the challenge is how we're going to work together in order to turn that tide and to make a real difference. And kind of what lessons does this this immediate pandemic show us and prove that we can do. I think the light at the end of the tunnel is, I think, with the right money and the right investment, the right support, the right intention, it has to be possible to end rough sleeping in London.
Brilliant, thank you. That would be an incredible bit of silver lining to a grim situation if we could achieve that. Could I turn now to Guy, and could you say a little bit about how it's looked from a local authority perspective, and particularly how that's worked in Camden, which I think also has one of the highest levels of rough sleeping in London, in terms of getting people off the streets, getting them safe, and making sure their needs are met. You're on mute still, Guy.
Indeed so, thank you, Richard. Yes, like all boroughs, we've faced an unprecedented challenge, adapting our service models very quickly and reaching out to the most vulnerable, actually with depleted professional staff numbers. Nonetheless, with the aim of moving as many people off the streets in the initial phase of this crisis as we possibly could. We do operate in a pan-London environment with a number of services, of course, commissioned by the GLA, and a number of services commissioned between our neighbouring boroughs, for example. Nonetheless, there are different dynamics across London, and each borough can throw up, different what we call push and pull factors. So, for example, the experience of, say, Hillingdon Borough, which is host to a central London borough like Camden, and actually those dynamics have meant that some resources have had to be moved around quite quickly. I think Camden is very representative, though, of a central London borough, with some factors which are shared and seen across central London, particularly I would say with the level of flow onto the streets. These are people who are new to rough sleeping, or who have not been seeing rough sleeping in a particular borough for a long time, or they are. We also see a lot of returning rough sleepers, particularly of the more entrenched and very transient population that do tend to disengage quickly from services across London. We also have high levels, sadly, of drug activity, street-based drug activity, and high-risk daytime street activity. Higher numbers of those with no recourse to public funds, and the vast majority of people rough sleeping in Camden actually don't have a former connection to the borough. Nonetheless, we deliver services under our Roots Off the Street strategy, which ensures that everybody receives a service offer, which means they no longer have to sleep rough and are able to rebuild their lives away from the street, regardless of what part of the UK they've come from, whether they have recourse to public funds or what their connection is. So just moving on a bit into how we've responded in terms of some of the specifics, we of course work with our strategic partners, the GLA and the MHCLG, to identify the resources we need for all rough sleeping cohorts, but particularly the higher risk, those with higher needs that we see on the streets of Camden. Initially, of course, we responded to this crisis with the drive to get as many people off the streets into safe places where we could work with them and actually identify what their next move was. Initially, we used commercial hotels, which offered low or no support. We were able to do so with the collaboration of charities in the borough, for which we're enormously thankful. While that measure, I will say, had limitations and actually it had risk, we would not have been able to actually get people off the streets if it hadn't have been for the work of charities, who actually provided the food, the befriendment, helping people move from location to location. All of that requires resources, logistics and coordination. And of course, our outreach team, hard pressed as it was, at some point was working with something like 50% of its professional capacity due to the issues we've seen over recent weeks. I want to talk a bit about our response in terms of the pathway. So Camden actually does have quite a strong network of hostels called our adult pathway, in total about 670 beds. We were able to adapt that model very quickly and provide a COVID care facility in the borough. We also commissioned a hotel in Camden called the Britannia, which we jointly commissioned with Public Health, the CCG, housing commissioners and our substance misuse resources, and the NHS to create a COVID facility providing wraparound support, but crucially integrated health support from teams really working together and just recognizing those complex issues and working around the risks around each individual to ensure that they don't return to the street. This flexible approach, we believe, was instrumental in what we see as a successful model. And for example, the delivery of methadone direct to service users and the delivery of primary care, particularly for those whose GP may have been in another part of London, or actually they didn't have a GP at all. So our health practice in Camden, known as CHIP, adapted very quickly to that challenge and actually oversaw health cases. And finally, we actually took the measure of testing everybody in the Britannia Hotel through working with the UCLH-based Find and Treat team, who I think have also been working closely with the, in terms of the GLA response as well. You know, they have been outstanding, and I think it just shows what we can do when we start, you know, working together across different hierarchies and boundaries, or whatever you want to call it. I want to just quickly touch on numbers. We started this journey around mid-March. We were measuring our street population as around 50 in Camden. In fact, we've worked since then, over 7 weeks, we've worked with about over 200 individuals. We've accommodated 160 individuals, and we're still estimating numbers on the street to be 45. So you can see straight away the challenge of a transient population. These numbers are not linear. So we've seen, due to the stagnation of the economy, new numbers arriving on the street. And these are people we would not normally have seen as well. People perhaps on the periphery of society, who are working in low-paid jobs, in temporary accommodation, who due to these circumstances have arrived on the street. We've also seen the transient population in London. They're still moving around London. We're still seeing some of those in Camden, and we're seeing people returning to rough sleeping, perhaps because there aren't the day centres open or the other facilities which would have prevented them returning to the streets. And I think, you know, recognizing that some people have are predisposed to sleep rough because they have trauma in their lives. When they wobble, you know, they don't have the same resilience that perhaps we have in this room today. Challenges and opportunities, very quickly, I'm probably running out of time. Recognizing just the complexity of need, you know, resources need to be targeted at those who present that complexity. Addiction, mental illness, people with damaged lives can also harm others, recognizing that, the coercion of others, domestic violence. No recourse to public funds, finding long-term solutions for this cohort that we've temporarily housed. It's been an amazing response, but nonetheless, there aren't long-term solutions for those who have arrived in this country seeking work, perhaps, but find themselves in the predicament of rough sleeping. We have some solutions out there for them, directing them into safe, sustainable employment, but also the option of their return to their home country, should they wish to do so, with consent, dignity, support, and safety. Health, integration works. It really does. I'm not going to say more about that right now. The Britannia model showed how it can work. It really represents lots of flexibility, lots of creativity by a lot of people working together. Just another reflection on the last 7 weeks. I think, personally, there are moments I felt a bit overwhelmed by it all. I'm sure I'm not alone. I think the sector has faced a really, really unprecedented challenge. And yet, it's really dug deep, and, the resilience shown, the fact that we are here and we've achieved this far and are able to kind of look the challenges ahead full in the face is really quite remarkable. Thank you.
Thank you very much, Guy. And again, a lot of challenges for the future there, but also a lot of evidence of what can be achieved quickly when agencies work together. David, perhaps I could ask you, and we're starting to get some questions in, so do fire other questions in, and we'll sort of try and divvy those up. We're getting the first couple in now. David, could I ask you to, and perhaps picking up on some of the things that Guy said there, I know that you've been working on some of the COVID care hotels from the GLA. I know that's been a GLA initiative. And also perhaps stand back and think where some of the longer term lessons might be for joint working between the GLA, boroughs and charities, and how, what might need to happen next in terms of policy, in terms of lobbying. Any other reflections as well?
Thanks, Richard. Of course. I was kind of preparing for this and looking back and trying to work out, I think it was the 18th of March, where I met with the Secretary of State, arguing that we needed to take this seriously and that we needed to do something. And from now, we've got over 1,226 people, I think, this morning in GLA, Pan-London hotels. The boroughs have got about 2,000 people into hotels and temporary accommodation. It has been amazing how much we've achieved in such a short space of time. And as Guy and Petra have said, it is a testament to the amazing joint working that has happened. And I think that's one of the major things that I definitely think we have got out of this, is a joint working with health, is a joint working with other partners, whereas instead of it having to go through umpteen boards, be agreed by everyone and his wife, it's been a matter of getting on with things and then working out how we do things afterwards and how we ensure the paperwork and everything matches up with that. So I think that has been a testament to everyone's amazing work. In terms of the COVID care facility, yes, we have a COVID care hotel that's run in partnership with... David, yes, can you hear me?
Can I ask you to get the mic a little bit closer? Some people are saying they can't hear still. Thank you.
That's quite all right. Sorry, my computer, my laptop gave up. I think it's working the kind of 16-hour, 7 days a week thing that we have been for the past few weeks. So yes, I just want to say, in terms of in relation to the COVID care hotel, we have one set up with, as Guy mentioned, the UCLA Find and Treat team. So our story, we've also got kind of Medicine Sans Frontières going in and going to use that. As Petra said, I think it is due to the testament of the amazing work that we've done that actually that facility has not been as busy as the predictions were starting when we first did this work, and we were first working with public health. There were predictions of a lot higher numbers of our clients, unfortunately, that were likely to become infected with COVID. That has not happened thus far, and I am touching a wooden desk as I'm saying that. But I think I don't want to dwell on kind of where we are. I think you're right. I think we need to look at where we need to get to. I think one of the major difficulties and one of the major things we're all working on now is those next steps. The people in the hotels, how can we ensure that we're making the most of the opportunity of getting everyone into accommodation, everyone we has got in? How can we ensure that everyone remains in for good, that they accept those accommodation offers or those offers of ongoing support? And I think Guy's is completely right. I think one of the most difficult areas that we potentially got, sorry, there's just someone at my door, let me just go and answer that at the same time. One of the most difficult areas that we face is around those people with no recourse to public funds and around EEA nationals, as to how exactly we can provide the appropriate support for them and the correct options for them. So I think that is going to be something that we're all struggling with and trying to work out what exactly we can do. We decided really early on when we first started this work that we were going to concentrate on the winter night shelters to start off with, and getting people that were sleeping in communal areas into individual accommodation to ensure that the safety of the clients could be appropriate. And I think that is something we need to consider really highly going forward. Is lots of the faith-based situations, lots of the services I commission and Petra runs for us in terms of No Second Night Out start with that more communal setting, in terms of people coming in from the streets to a communal setting to then work out what the options are for those clients. That's not something that in COVID we can continue with. So, but it does create a huge gap of provision that used to be there, and something that we really need to think about in terms of moving further forward. I think one of the other kind of struggles that we've faced, particularly in relation to EEA nationals, is obviously as part of this, what happened was the settled status kind of process stopped within government, and that has meant that obviously it's difficult for us to kind of work, and for Petra's team especially, to work with clients to kind of work out actually that they are in the process of getting settled status. We're moving along with that path. That is going to be the option for that client, which will open up avenues of accommodation and avenues of further support. But actually we don't know when that's going to start reopening, the pressure we can put on in terms of that. I think there are the usual issues that we have in terms of around LHA rates and everything else. I'm really conscious of time. So yeah, I mean, I think in summary, we are working on the next step strategy. We've got a whole host of people in that I didn't think we'd be able to do in such a short space of time. And the joint work with, as Guy mentioned, in terms of with health, we've commissioned a Pan-London Substance Misuse service. There's been some amazing steps and some amazing things that we've gone, but I think we need to work out how we seize this momentum, and how we seize this momentum not just for those people in the hotels, but for the whole system. So, I mean, I'm always really keen that actually the most complex people that we're working with are generally in hostel provision. They are not in the hotel provision. They need potentially the support that health colleagues are at the moment really willing to give in the hotels. But how do we ensure we grasp that, work with STPs to work out how we can bring this all close together? But it has been a phenomenal effort. And yeah, I think I've seen Petra more often, even though virtually, than I have done before, in terms of hourly phone conversations and yeah, daily meetings. But I think what we've achieved has been quite remarkable, and what her team, the frontline staff, have achieved has been absolutely outstanding.
Brilliant, thank you. Thank you very much, David. We've got a first few questions coming through. I didn't say earlier on that just so people know, because people will know each other who are involved in this webinar, I will, unless you anonymise your questions, read out your name, because it does say your name unless you submit the question anonymously. I hope that's all right for the first couple of questions. They're not particularly controversial, I hope so. A couple of questions. One about the issue of how the boroughs have managed to get people off the street, partly by ignoring the requirements for local connections. And I guess that connects also to the extent to which a lot of the people perhaps receiving services now are people who are in no recourse to public funds, or people who are maybe even completely undocumented and off the radar. How possible is it to keep that sort of emergency approach going longer term? Perhaps Guy and Petra's thoughts on that.
I can start, Petra, if you'd like. It's a huge challenge to sustain that approach for Camden. Maybe 1 in 5, 1 in 6 of rough sleepers in Camden actually has a former connection to the borough. Nonetheless, we've accommodated. We've moved into a mode of complete equality of access and that's enabled us to use our local pathways differently. Because of the pressure that puts on resources, and of course the provision of statutory services under the law, that wouldn't be sustainable in the longer term.
So, I mean, first of all, we're still trying to understand the data. The first thing we need to do in order to get to a solution is to understand what the issue is, what the problem is, and who we've got. And we're still trying to understand the demographics and the support needs of the people that we've got off the streets. And unsurprisingly, as Guy has said, and as David has mentioned, is that a large number are non-UK nationals. However, within that, a large number absolutely have a right, probably, to settled status. So there is a solution, absolutely, a solution, which is let us open up the doors to get people settled status in order to be able to help them like we help everyone else. Okay, so that's just one thing. There is an absolute solution. I think let's remember that there's a solution to this, so people don't have to remain destitute. Within that cohort, and we've done a very quick analysis of who we've got, and we have a smaller number of people who are non-UK nationals outside of the EU, who have got complex immigration issues. And I've done a bit of a deep dive into that. And again, that's about people who need a quick resolution and fast resolution. And there are a number of different barriers as to why they've remained destitute. I think it's really important to make clear that with this cohort, the GLA and the charity, not-for-profit sector, have been supporting this group for many, many years now. So through the GLA Commission services, there is a sort of, many of the services have been picking up this cohort, and the charity sector have picked up this cohort. And I think that what the COVID pandemic has shown is how many have been perhaps off the radar in the night shelter type provision. Because when we first decanted the night shelters, let's be honest, majority of those are people who are able, willing, ready to work and could contribute to this economy. So it has, got huge possibilities. But it's also shown us that this collaborative working, that if we actually are not rigid about local connection, affords us a huge different way of thinking and working. However, the challenges for the boroughs, and many of the challenges I've heard for the boroughs, is that those, I can't see a time soon where those local connection rules will disappear. However, I would like them to, because as we know, London and Westminster, the highest rate of rough sleeping in Westminster, is Westminster. And let's face it, to tackle that, it's not Westminster alone that can tackle it. It's a London problem. Yeah, it's an England problem. And in some cases, it's been a European problem. So I think there are real lessons and reasons why, in this scenario, for sure, local connection, in my opinion, should not apply.
Brilliant, thank you. I've got a number of questions about the sort of Britannia model and the hotel model in general. Nikki Barnett asked whether the Britannia model could be replicated, considering the continuing number of rough sleepers in Camden. I think that could extend to other boroughs where there's hotels. And David Kane has asked, over what period will clients start moving out of hotel provision, and what can they move to? And I suppose that's particularly challenging because we don't quite know what the trajectory of tourist trade is going to be in London over coming months. So thoughts on the extent to which we can do more with the hotel model, which I suppose is, I'm probably talking about things I don't know about, probably a housing first model through crisis, and how people can move from the hotel model into more settled accommodation, given the challenges with temporary accommodation there are in London anyhow. Petra, perhaps, David, start with you. You came off mute, sorry.
Oh, don't mind. Yeah, I mean, I think in terms of more hotels and going forward in terms of that, and high number of our hotels were waiting to a decision in relation to lockdown, in terms of whether they would, in terms of around contracts, around that side of things. So I think that obviously feeds into it. And I think also, as Guy and Petra have mentioned, it is about funding. This is potentially, if you know what I mean, in terms of continuing those models. This is not a cheap service, if you know what I mean, to do in terms of funding. Funding is needed, and ongoing funding is needed if we are to continue with the hotels and to look at a different kind of model. In terms of around the moving out, and that's what I was mentioning in terms of around next steps, in terms of the clients that are in there, as Petra says, the first and most important thing is us getting our handle on who exactly is in there, what are their needs, how can we then develop the appropriate plans in terms of for people to start moving people out. We've already had people already move out of the GLA hotels into more permanent housing. That's already happened. That's not something that we are waiting to do until we get to the right stage, until it comes to the end. So we're very much thinking and working with the boroughs and with London councils and with CLG on what is the next step. How do we ensure that we grasp this opportunity for people who have come in this way to ensure that actually they move into the more permanent accommodation. But in terms of what that looks like, we do think quite a lot of that will be private rented sector, people moving into the private rented sector with a small amount of floating support to start off with. But until we have that granular data, we can't say for sure what the options are, and making sure that we can put people in the right boxes, if that makes sense.
Sorry, great, thank you. Guy, do you want to maybe add about whether you could extend the model within Camden in the context of the Britannia Hotel and the continuing flow of people onto the street?
Yeah, sure, I can offer reflections on that. I mean, I suppose the first thing to say that Britannia is a commercial enterprise, and at some point will want their business to return to normality, I imagine. Successful though it certainly has been, and I will say that we want to continue with the Britannia model through this phase and into the succeeding phases, including as we think the exit strategies look like. I think in terms of what we take from Britannia and actually take forward as a borough and offer learnings, I think certainly the integration of services, the removal of the sort of normal human barriers you get between teams has made a huge impact in terms of health outcomes for the cohort. Bearing in mind just how challenging they are, and the ability with the Britannia model really just to wrap around support around the individual, a little bit like Housing First, which has been mentioned. Of course, Housing First is a much more stable and long-term model, and therein perhaps lies some kind of answer, because of course we can't keep Britannia going for all sorts of variable factors. We obviously can't keep it going in the longer term. We haven't, as a borough, actually put a timeline around our approaches and exceptional measures, simply because we can't. There are too many variable factors. The government announcement, the return in some sectors of the economy to normality, and indeed finding the longer term solutions for some of the people that we've housed temporarily, and ensuring that they're in place. Upholding the in for good principle, which David mentioned, to ensure that no one that we've accommodated during this phase has to return to the streets.
Brilliant, thank you. Guy, your sound cut in and out slightly there. I think we got most things, but we'll keep an eye on that, and maybe if it doesn't work out, it might be best for you to go voice only, because I think that just lightens the load on the connection. But let's keep you on video at the moment, and let's see how it goes next time around.
Yeah.
A couple more questions about the current situation. Then several people have asked questions about, how the long-term policy asks and policy positions might be repositioned. So I'm coming to those questions. Had one quite specific one from Robert Payne from Hope Worldwide. Some of those referred to their service by night shelters and local authorities for PRS access have been put into hotels. Should people be working directly with the person and the referrer, or should they also be working with support agencies operating in the hotels? Who would like to take that? This is the question.
They should be working, yes, with a support provider in the hotels as well. The more we can combine on this, the more we can hopefully help people quicker.
Brilliant, thank you. And another question, which I suppose bears on the hotels issue, is from an anonymous questioner. How are people who are being accommodated being monitored for drug use, etc.? And I guess that can be extended to other, what's the correct word, challenging behaviour, I guess. And how is this being dealt with if fault is found? Have there been issues with damaged facilities, and how would this be paid for? Any issues emerging there?
I mean, we've had a great response from human beings who've come off the streets in all shapes and sizes with all sorts of kinds of support needs, and of course, not everyone has behaved impeccably. So the hotels have obviously got their own rules and regulations, and have probably applied their own rules that perhaps we might be a bit more flexible on as an organisation, and particularly around alcohol as a good example, particularly around smoking. These are some things during self-isolation that we all know that probably, what is it? Everyone's talking about us. Well, I'm certainly getting fatter. There's no doubt about it, because I'm certainly drinking more. There are things that help us cope to keep us, indoors. So, our homeless population face exactly the same challenges. And one of the things around substance misuse, I think it's really upsetting to see how many people didn't make it and haven't made it into this provision simply because of that, because actually their needs are too high. But where they have, and good examples like the ones in Camden and some of the ones that we manage and other providers, it's been quite remarkable how suddenly scripting has happened quicker. It's been remarkable how we can do things differently, how the barriers we perceived before are no longer barriers. And I think if this offers an opportunity for future thinking, I think what this has shown is that they are artificial barriers. They are barriers that organisations or policymakers have put up. And there's absolutely no reason why this shouldn't, we shouldn't be able to crash these things down. So I suppose the answer is, we've got some specialist support also through the GLF commissioned. I think it's Turning Point and CGL. I'm sorry, to help, and they've kind of put in measures in place and supported our staff that have struggled with some of these things. But too many people are still on the streets. But where it has worked, it's because we've actually been able to change the rules a bit. Yeah. And I think that's a good, we should be changing the rules. If there's an opportunity to change the rules, now is the time.
Brilliant, thank you. This is just right. I'm going to ask a couple of questions about sort of the moving to the future now. And Claire Richards has asked about, which comes back to something that was said about the difference between people in hostel accommodation and hotel accommodation. Moving people in hotels to permanent accommodation, is it fair to prioritise the people who've come off the streets into the hotels over people who are on housing lists or in temporary accommodation? How do you square that circle? David, you go off mute, so you get the question.
It's a very difficult, I shouldn't have done that. It's a very difficult question to answer, and it's something that is taxing us all. I think because of the potential cliff edge that we will have in terms of some of the hotels, as Guy mentioned, they will want to go back to business as usual. So at some stage, that does give us a need to be able to focus potentially on those. What I think we need to ensure is that for some other, sorry, my daughter's singing in the background. There is the possibility that I think we need to be doing more kind of Tetris style moving people around, which is something that we've all been talking about in terms of around some of this might be moving people out of hostels into clearinghouse provision, into housing association provision to then free up space in the hostels to then move the people from the hotels. We need to, and that's what we need to be thinking about is throughput in the system. This should not be that, yes, just because you were on the street and you ended up in a hotel, you are suddenly getting a different offer to someone who's coming out. But I think we have to be realistic that, yes, they do have a cliff edge, the hotels. And so we need to ensure that wherever possible, we're ensuring that people can move into more permanent accommodation. But that might be a more kind of sideways step into a hostel, and then the hostel space being freed up by someone who's been on the list for longer.
Brilliant, thank you. I'm going to try and rattle through a few more questions and just to get as many in as possible. I think a question here, how are councils and service providers preparing for the rising tide of new people presenting as homeless, which we may see as the economy spirals downwards over time? Perhaps any thoughts on that from Guy, from a local authority perspective? I think Guy is frozen in terms of video, at least. Petra, do you want to answer on that?
Sure. So in terms of flow, we have seen and we are seeing an emergence of newer people coming onto the street, that particularly like from the hospitality industry. There's a couple of issues around this. One is capturing that and making sure we capture that, which has been particularly difficult in the last 7 weeks or so because of the nature of provision and who's out there and who's on the streets and how we capture that information. But we are starting to capture it. We're also needing to respond in some way and just not present a big black hole. And I think there's been a big black hole. We've only now just experimenting with a pop-up no second night out. So in other words, trying to do something different to what we've done before, trying to respond and understand who's out on the streets in terms of flow. But I mean, let's be really honest. I mean, the question of prioritization is an interesting one, because I would be prioritizing those on the streets. Never mind those in hotels and never mind those in hostels. There's the real issue here is about supply. The only way we can get ourselves out of this situation, and remove rough sleeping, is by having supply and by having enough units. And we're not magicians, and I certainly don't have a magic wand. And those people that are currently in the hotels and the people that are on the streets, let's be really honest, the majority, if not all of them, want to get off and want to get into their own accommodation. This idea or this notion that people choose to sleep rough or choose to be homeless is just a complete nonsense. And we've got people on the streets now and who are waiting to get into a vacancy. So the real issue here is we just don't have enough accommodation options. We don't have enough supply for everybody. So yes, we'll have to prioritise, and I would be prioritising those those most at risk of sleeping rough and being in danger. That's how I'd prioritise. I don't know how else to prioritise. And that could be people in hostels, it could be people in those hotels, but it certainly is people on the streets. And that does include people who are new to the streets. And everything's all but gone in terms of prevention. Although I have to say, local authorities that often get a bashing around this, I've seen some incredibly fantastic work from local authorities stepping up, safeguarding the most vulnerable and housing people who are also at risk. So I've seen some incredibly, fantastic pockets of work happening, but of course it all costs money, and actually this is all going to come out in the wash somewhere in the future.
Brilliant, thank you. I'm going to link together a few questions just about looking to the future, which I hope will start bringing things to a close on a sort of bring together some of the positive things we've been saying already. I suppose three sets of questions. One, including from Jim Collins, is how policy asks have changed and how the sort of things we need to ask from central government have changed through this crisis, and whether central government now see, another question that came in, that homelessness and rough sleeping is a public health issue. So I think what we should be asking for from central government, what maybe it means for commissioning and new learning in terms of commissioning services. And thirdly, I've had a question from Jonathan Miller about how small charities and faith-based institutions can feed into longer-term strategies and reposition their resources and volunteers to new models of service. So I suppose there's three tiers. What's going on in terms of the central policy asks, what can be done in terms of commissioning locally, and also how can we sort of mobilise and maintain momentum from volunteer groups. Perhaps I could go to David, Petra and Guy for observations on that and observations on the discussion in general in that order. David.
Sure. Yeah. I mean, I think in terms of the asks for central government, I don't think these have changed that much in terms of but yeah, I don't think they've changed much. I think they've more crystallized in terms of us being able to ask them and being able to ask the right people at the right time. So I think the public health emergency kind of branding of this has certainly helped in terms of remove some of the barriers that were immediately there. I think what we're now potentially seeing and where our nervousness is that those barriers are starting to potentially go back up in terms of around local connection, in terms of around that side of things. Understandably, as the funding gets tighter across the board, if you know, I mean, government are getting more worried about what this might mean in terms of moving further forward as our council. So I think that's something that is definitely changing. But I think in terms of asks, I don't think our asks have changed that much. As I mentioned earlier at the start, what definitely is not an option is around that communal sleeping that used to be a default, if you know, a default option. And mentioned in terms of around the faith-based groups, that was, if you know, in the winter night shelter circuit has been an amazing thing that has been used, if you know, it has been utilised by so many people. But that is not something that is possible in, if you know, in this necessarily as we're moving further forward in the short term at least. So that's something that we need to work out how we work with the faith-based sector to improve that. We currently fund Housing Justice to do our Equipping Shelter project, where they've helped fund a number of night shelters and helped work in terms of with them. We'll still be funding them next year in terms of for their workers to work out what is new models, how can we ensure and harness that expertise and that will in a different way. But I think it's something that we all are thinking about. As Petra mentioned, we've been trialing a new model in terms of around temporary no second night out to see how that might work in terms of as a triage centre. We need to work out what that means in terms for new people coming further forward. So I think there is a whole host in terms of around commissioning. From my side, I don't think it's made it. I think what we learned from it is what we've already known, is that outcome-based commissioning is the way forward. A grown-up relationship with your commission provider in terms of around, this is a partnership. This is not a commissioner. You tell the provider what to do, they do it. We all work together. This is how I've always worked. This is how we've always worked in terms of as commissioners anyway. So I think it's just helped crystallise that is how we should do things, rather than it being the commissioner knows best, the provider just does what they said, and these are the KPI, that's our contract. If Petra did that with us, then we wouldn't have ever got any of this going. If it had been, this isn't the contract, what we're supposed to do is something completely different. And that's been the same across all the providers that we're working with. The Thames, Richard, look, head to Paul, SHP has been right. How can we do things differently? How can we do stuff? We'll sort out the other bits afterwards. So yeah, I think that's kind of the summary for me before my daughter goes even more crazy.
Brilliant. Thank you very much, David. Petra, your reflections.
Yeah, I'll try and be really pithy. I mean, I think the first thing to say is that, you know, the same issues are with us now as they were before the crisis, before the pandemic. They're exactly the exact same barriers, the exact same challenges, and that, you know, huge Mount Everest is there looming. So exactly the same. And I think the big ask of government is to seize the moment and to realise this is an opportunity not to be missed, an absolute opportunity not to be missed. And it would be crazy and it would be obscene for us not to have a commitment from everybody that we will not go back to seeing the numbers that we saw before. And better, let us not go back to seeing any numbers on the streets, okay? And to look at what we've learned. And what that will require is looking at the recommendations that charities like St Mungo's and others have put forward, you know, during the Rough Sleeping Initiative and the reviews around rough sleeping and homelessness. Look back at those, because therein lies a lot of the answers. A lot of that work's been done. But I think what we need is the speed. And I think my conversations and why I'm going grayer is I'm panicked about the speed of change. So we reacted really well to get as many people as we can off the streets. But now the speed, we mustn't let bureaucracy or anything stand in our way. And I fear that could well stand in our way. So in terms of future commissioning as well, I think also let's look at it through a different lens. You know, what's worked, what's different. And for example, one of my big bugbears has always been, let us not commission services and let us not do things that means that people have to sleep rough in the first place to get a service. Let us do things differently. Let us change the processes that we have built, and rightly so. And I understand where they've come from. We have built processes and systems to respond to rough sleeping, but we have also created a monster. Okay, and that monster is, if you were sitting up in Mars and looking down. And I haven't gone crazy because I've been locked in, self-isolating, thinking about little green men and women looking down at us. But it's possible. If you were to look down at us, you would have to ask the question, wouldn't you? Why do we do the things that we do? And why do we do them the way that we do them? So this is a great time to ask that opportunity, to ask that question. And therefore, it's a great time to suggest and think, well, how can we do things differently to get a different result? Because as we know, if you always do the same things, you're always, the same things will always happen. And I think in particular around people having to come to the street to get a service, it's a nonsense. It's a nonsense. So I would say that's the answer to that. And my final question about the faith communities, an absolutely essential component of not just this moment in time, but every moment in time around being a solution. I have to say, I'll do a big shout out to an organisation like Greenlight and who've stepped up. We've got amazing infrastructure volunteers, and they stepped in and provided medical triage and medical doctors when the health service couldn't. Without them, we would never have got to where we got to in terms of speed. There's absolutely no doubt about it. So there's a huge value, huge value. I think that we have got to, all of us, look at what we're doing entirely differently, and use this opportunity to not go back to how we all, and not to perceive things in the way we've always perceived them. That would be my final thought on it.
Thank you, Guy.
Asks of government. There's something for me very much about the funding of prevention services across the UK, ensuring there's a very consistent, comprehensive and rich response, appropriate response to preventing homelessness, remembering that it costs the public purse more than £20,000 a year for an entrenched rough sleeper, but much less than that to actually prevent them arriving on the streets in the first place. I think the Homelessness Reduction Act was some attempt to do that, but it doesn't appear to be working effectively. In terms of commissioning, I think the days of dormitory accommodation are gone. I think we've all picked that up today. Certainly we need to bring back some of the really vital services like No Second Night Out, like our cold weather shelters, but bring them back in a way that's safe for everyone to use them. I used to, in fact, I still do, get in my inbox all sorts of emails from architects and designers with very funky looking pod style solutions, to the point where I used to delete them. Now I'm suddenly thinking, actually, that is what I need now. And actually one arrived in my inbox yesterday, which I'm now giving kind of careful thought in terms of how we can flip some of our resources and make them future safe, future proof for COVID. There's also something about commissioning, and it's been touched on before, but actually in Camden we were doing this already, really looking at kind of co-commissioning, joint commissioning, service integration, and more of a one-team approach. We did have some services in the borough that had different providers, that they were delivered through different bits of the council. And certainly the collaboration with public health has been a complete game changer in Camden and elsewhere too. And in fact, we commission our Routes Off the Street service jointly with public health, and that's really opened so many doors. Priorities, I think there's something for me that we've very quickly accommodated a lot of people, including some people with relatively low support needs who arrived on the street because of economic stagnation. And actually their solution probably is returning into the economy in a way that's safe and sustainable, rather than diverting them into rough sleeping pathways where they would inevitably then be drawn into contact with much more complex individuals. But also we really need those resources for the most complex. And I think that's sort of where this point is leading to, is that, particularly in central London, but actually all over London, we see many complex individuals who really need to be in a supported long-term pathway before they can reach any level of independence. And I think that is where our future prioritisation should be going.
Thank you very much, Guy. We're over time now slightly, which is entirely my fault. Thank you very much to everyone for their questions. I mean, I think it shows an extent to which there has been incredible success and incredible galvanisation of new partnerships and new ways of doing things and cutting through some of the bureaucracy, red tape, crap, whatever you want to call it, that is difficult when you're working in the public sector or working near the public sector. And there's a question of sustaining that, but also refocusing on prevention. I suppose, you know, just as we need to tackle the epidemic, but also stop a new one happening, we need to take advantage of the opportunity we have now to address rough sleeping, but also to refocus on prevention coming out of it. And clearly huge lessons in terms of integrated services and how different parts of the sector can work together to make a real difference. So to me, some very positive, perhaps surprisingly positive lessons, and a huge opportunity to actually make sure those are sustained as London recovers from coronavirus and from the lockdown that's been caused by it. Thank you very much to David, to Petra, to Guy. Thank you very much to everyone for joining us, for your questions. And I'm sorry we didn't manage to answer all of them. I think we managed to answer most, but thank you for participating. We'll be holding more of these events. Please follow us on Twitter, sign up to our newsletter. I think the only other thing I have to do is to thank Caroline and Deanna, who in the background have been making it all work. So thank you very much and enjoy the rest of your day. Good afternoon.
Thanks.